role of a school nurse is not a solitary one, far from it. In this programme we'll be looking at 6 examples of school nurses working with other professionals, education welfare officers, teachers, learning mentors, and a raft of outside agencies.
The more professionals work together from the beginning and the earliest intervention, the better.
Being part of a team is really important.
We can't work in isolation. There's always other issues for the children.
The story of 8-year-old Victoria Colombier rocked the nation. It was a huge failure of the child protection system, and the government acted to ensure such a case could never happen again. The resulting policy document, Every Child Matters, is now the guiding light for statutory agencies and schools.
Every Child Matters is a hugely significant piece of work for us all and is acting as a real guide. Nobody wants to see any child slip through the net and be missed, and this multi-agency approach will actually contribute directly to ensuring that that won't happen.
But it's not just about child protection. Every Child Matters is as much about preventative work and informs everything school nurses do. Jodie is a special needs pupil at Grangehurst Primary School, and it's the school nurse's responsibility to work with the school professionals to ensure she is well cared for. School nurse Elsa Chadaway meets to devise a plan of action.
The idea of today is that we can write out Jodie's healthcare plan, so that we can decide how we're going to look after her in school, just in case that she has an epileptic fit while she's in school. So this is about emergency treatment, really.
Okay.
And of course, you know Louise is going to be there for her all the time.
Yeah.
So first of all, we need to describe what her condition is. And I've got the last letter from the doctor. She's got a left hemiplegia. And she's got epilepsy.
Yes.
And she's got some problems regarding her dribbling.
Yes.
Describe the condition.
Basically, Jodie only tends to have night seizures.
Right.
And what tends to happen is she'll be absolutely fine, and then the next minute her arm starts twitching.
Right.
So it's just like a little twitch. And then her actual face will actually be fixed to the left, and her eyes are fixed to the left, so then she's actually like that. And then she's just twitching. But she can still be talking to you.
Right, so she's still conscious.
She's still conscious.
Yes.
But then she'll just get worse, and then she'll start being sick, and then then she would go unconscious.
Right. We decided last week that as soon as she started to have her seizure, someone would be staying with her, obviously. Somebody would be fetching the medication.
Yeah.
Somebody else would be phoning the ambulance, and yourself.
Yeah.
And that would be phoning the ambulance right from the beginning.
When Jodie had her first seizure, we did have a bad experience. We had to wait over half an hour for an ambulance to come. It was very, very frightening, and every minute just seems like ages, and when it's half an hour, it just seems like a lifetime. So that is always in the back of my mind, is an ambulance going to come?
If Jodie has a fit, then there'll be a member of staff that will take all the other children into another area, so all areas covered.
That's great.
Right.
Yeah.
That's great.
That's my main concern, of the ambulance not getting there on time.
That's right, yeah. And sometimes what they do as well is that if you're very clear that this is an emergency, they will sometimes send out a paramedic first, and then the ambulance will follow afterwards.
That's fine, that's reassuring.
The school nurse also helps to ensure health standards are maintained across the whole school by working alongside the school management team. Today, Elsa's meeting the deputy head to audit the school's health policy and plan for the next 12 months.
Here in Coventry, in the school nursing service, we do a school health profile on every school every year. And that covers the health needs of the whole community within the school. There's a few things that we need to be doing in school health-wise over the next academic year.
The health audit is a liaison between school and the health service to actually make sure that we're catering for the needs of all the pupils in school. It's been a real bonus to have a school nurse. When I first came here, we didn't have one, and Elsa's been invaluable at supporting the school.
We perhaps need to do some training for teachers on epilepsy, diabetes and EpiPen.
That's really important. I mean, we did do some on asthma last year, but there are other things in school that we really need staff to be aware of now. The administration of medicine policy, which I wrote together with Elsa, that's been invaluable because she has all the knowledge from the Department of Health and all the documents which she brings along, so we know legally we've got exactly what's required really. So that has been great too.
What is the situation around drinking water now in school?
Well, we've encouraged children to bring the bottles of water so they can have access there. We also have got the water fountains. Right. Perhaps as part of the Healthy Schools initiative, we made free access by bringing water bottles, and we've also developed the fruit scheme where children in Key Stage 1 have fruit every day.
Yeah.
Hi, we're Fruit Bats. We deliver fruit to every year group in Key Stage 1.
The Fruit Scheme is a government initiative whereby each child receives a fresh piece of fruit every day, and with research showing that 1 in 5 children don't eat any fruit at all, it's welcomed by most.
It makes you strong, it makes you healthy, and it makes you run fast.
Grangehurst has recently been awarded the gold standard for healthy schools, and their outstanding trim trail helped them to win it.
How does that work? Is it just in lunch times, or are they allowed it at other times?
We actually have a rota that goes on the board on a Monday, and teachers fill slots in, so the children have extra access outside PE lessons often to the trim trail. But it's also available at lunchtime with lunchtime supervisor who supervises it on a rota basis. So it's not a free-for-all because there are too many children, and that would be a health and safety issue then.
For Yvonne, working with a qualified health practitioner brings many advantages.
We're not medically trained. We may have some first aid training, but that's certainly not a great in-depth knowledge about certain conditions. And children now with inclusion, we're trying to include many more children into a mainstream setting, and that means we need specialist advice to do that.
The principle of professionals working together to share information is key. Here at Moat House Primary School, children are invited to join a daily breakfast club, providing the school nurse with an excellent opportunity to draw on the knowledge of colleagues.
We target children to come to breakfast club. We invite them to come. Maybe attendance is poor, they may be always late, looked after children, children that find it difficult to make friends, that sort of thing. If I had concerns, if I thought perhaps a child was underweight or a child had got, seemed to be off a lot, talk to Anne to see whether or not Anne had got any involvement, and then if it needs to be an official referral from there, then it will be an official referral. I think multi-agency working is very important. We all have little bits of snippets of information, and we've got to talk to each other. It's the only way we're going to get the full picture.
The principles of Every Child Matters and a multi-agency approach can be seen working effectively within Coventry's family support groups.
Hi everybody, it's great to see you again this morning. I know we probably all do know. There are 4 family support teams across the city which are part of social services, and the panels were originally set up for social services to discuss families where the children are not child protection or they're not looked after children but they're children in need, where we've perhaps worked with those families for quite a long time and not been able to resolve some of the issues within the family. My understanding on the agenda, we've only got 1 case to discuss this month, which Anne is bringing.
Anne attends the meetings regularly, bringing any cases of concern to the attention of all the professionals round the table.
There's 3 children, 2 primary school children and a preschooler. Preschooler in nursery, before she came to Coventry, there was concerns about some developmental delay. Mum's been having trouble registering with a GP, so she's concerned about that.
By supporting families early on when they've got problems, it prevents the difficulties getting too great and the children becoming child protection or looked after. It's also good for all of the workers as well, because we never know all of the local resources or the citywide resources, so it's really useful to keep on top of what's out there really and what new initiatives are happening.
We're also running a 10-week surviving domestic violence programme for the women, so that will teach them about raising awareness, help them not to go into the same kind of abusive relationships, work around communication skills, and helping them generally support their family as well.
Pooling of resources and sharing information is nothing new to Sue Garside. Although Sue's a student school nurse, she's spent 9 years on the paediatric wards and is used to the multi-agency approach.
In my old job there was a lot of multi-agency involvement, but I feel that school nursing has a greater breadth of the multi-agency involvement. It's actually taken it to a further level in the community. and school nursing is a very good example of best practice for that.
Thanks for letting me look at your reflective diary. It's a really good start that you've made here. And
I started my training in 1993, and then it was highlighted in lots of government reports that children and families and communities have a lot of specific needs, and there is actually a big gap in inequalities across cities as well, and that's still very evident, which is why as nurses we need to actually be pooling together resources from ourselves and from other agencies as well.
As part of the government's extended schools policy, Coventry has also recently formed its own BEST team to support the idea of multi-agency working.
The initials stand for Behaviour and Education Support Team. These have been set up by the government, and they're really pilot groups to try to establish the effectiveness of multi-agency working.
The team meets once a month and has representatives from both statutory and voluntary agencies.
I'm the Education Welfare Officer based at this school, soon to be full-time on this team.
I'm a School Outreach Officer and also seconded to the Common Assessment Framework as an advisor.
I'm a school nurse for Woodway Park Secondary School.
I'm a key worker for the Youth Inclusion Support Programme.
I'm a police officer. I'm a full-time member of the multi-agency team here at Woodway Park.
I'm a mental health nurse, working as part of the primary mental health team, which is part of the Child and Adolescent Mental Health Services.
I'm part of Parent Partnership Service as an outreach officer.
I'm the team leader for the Time for You Young People's Counselling Service with Relate.
I'd like today for each of you, just very briefly, to share together with the team what it is you think you can provide from your agency at this stage in relation to support work, either for the family, the young person, or indeed to even think a little bit broader in terms of feedback for schools and support work in schools.
We can offer one-to-one counselling work. We can go out into the schools to deliver that.
We can probably offer support to the hard-to-reach families.
My role would be to help fill in the Common Assessment Framework forms and advise, also perhaps go out...
The Common Assessment Framework will mean that all of us, in all agencies that work with children and young people, all agencies will be working to a common language, a common approach to assessing needs.
I think certainly from the Common Assessment Framework, any health needs that are identified for the children themselves, the siblings they're looking after, and for the parents.
I'll be able to work directly with young people whose behaviour puts them at risk of offending.
This particular work falls within the line of prevent and deter, which is part of what we're about in the police.
What you've got are people who are willing to join together and maybe not work in isolation and not be sole agents working in a particular way. So, I mean, I think that's very encouraging.
It's definitely a change for the better.
We know we can't work in isolation. There's always other issues for the children, and it's only by sharing the information that we have that you can build up a bigger picture for that child as well, or that family.
Britain's school nurses have proved how essential their role is in supporting our schools. And hopefully by other agency workers supporting the nurses' role, we can offer our school children the high standard of care they deserve.